So most of the symptoms that people are presenting with around long COVID are associated kind of breathlessness, whether that's when they're exerting themselves or actually when they're just at rest. Sometimes that can also come on as some chest pain or palpitations. They also get quite a lot of fatigue, which is quite closely linked to breathlessness. So a lot of the time, if one is worse, the other is also worse. We're also seeing symptoms of kind of brain fog and people losing concentration or not being able to concentrate for as long. Associated kind of reduced activity levels because of all the symptoms that we've spoken about as well. Yeah, so from a respiratory point of view and a long COVID point of view, breathlessness is a really key thing that people continue to have even after the acute COVID illness is gone. And actually what they seem to be developing is something called a breathing pattern disorder. So actually we've been treating breathing pattern disorders for a really long time. This is not a new thing around COVID. They've been around for a very long time. It's just they seem to be quite closely linked to COVID, I think because it is a viral infection that does attack your lungs. So ongoing people have a different way of breathing and that can cause them all manner of symptoms. And actually what we want to try and do is teach people how to breathe differently so that they go back to sort of what we'd call normal breathing. So kind of breathing from their tummy, breathing through their nose, breathing in sort of 8 to 12 times a minute. And actually trying to slow that breathing rate down, which will then reduce the breathlessness symptoms that they feel, which are not necessarily linked to anything structurally wrong with their lungs.